Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers who educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I'll be your host. Today's guest is Dr. Ron Hunninghake. Dr. Ron joined the Riordan Clinic in 1989, and as its medical doctor chairman of the board, as its medical doctor, and now currently serves as the chairman of the board at the Riordan Clinic. In addition to his full-time practice as a holistic medical doctor at the Riordan Clinic, Dr. Ron has made multiple trips to Japan, Spain, Ecuador, Colombia, New Zealand, Canada, and South Korea to lecture on Riordan IVC Protocol for cancer. He is a past chairman of the International Schizophrenia Foundation and has been a regular presenter at their Orthomolecular Medicine Today conference that has been held annually in Canada for the past 39 years. Here at the Riordan Clinic, he has presented more than 300 lectures dealing with all facets of nutrition, lifestyle, and optimal health. He has co-authored 3 books on subjects including inflammation, energy-boosting supplements, and how to stop pre-diabetes. Dr. Ron, it's such an honor to have you on the show. You're somebody that's been a staple in the integrative medical space for a long time.
Well, Michael, thank you so much for inviting me, and I'm more than pleased to sit with you and talk to people about ways that they can improve their health, because it's such an important topic these days.
Yeah, with everything that's going on around us, and people are just needing more and more tools available, and also the reassurance that some of these natural things that they actually are powerful enough to help the majority of people. So, it's a very timely, our discussion today.
Well, thank you for having me on your show.
So one of the things that I would say the Riordan Clinic has really set a mark, in the world internationally, is the vitamin C protocols that's been developed over there. So can you tell me a little bit, what is the actual function of vitamin C? I mean, why is it so important?
Well, almost every creature makes their own vitamin C. Humans, certain primates, guinea pigs, fruit-eating bats, certain other specialized fish, they do not make their own vitamin C. It's a kind of a conundrum as to how that happened, which we could talk about later. But the main thing is, for some reason, it helped us to survive to this point. It helps every other animal in the animal kingdom to survive when they are injured, stressed, infected, toxic, any kind of threat. They will start making more vitamin C. And we have lost that ability. The gene has changed, and we can no longer make our own vitamin C. Now, why would every creature in the world be able to do this? It turns out that vitamin C is nature's rescue molecule. It will donate 2 electrons in order to neutralize oxidative stress. And my good friend, Dr. Thomas Levy, will tell you forthright that all chronic illness, all injury, toxicity, all these infections, they all do their damage through oxidative stress. And so naturally, if you have a molecule that can get into any place in the body, including the mitochondria, that can put out the fire of oxidative stress by providing the electrons, that's a very powerful molecule, and that's what vitamin C is. And so from there, we can start talking about the whole protocol, but it really goes back to Dr. Linus Pauling, who was a friend of Dr. Riordan's, who, as a great Nobel winner, chemist, and world peace promoter, he found that vitamin C, if you used it in adequate amounts, orally and intravenously, it could replace that lost function, that long lost function in humans, and help bail us out from all the environmental woes and chronic illnesses that human beings are now prone to, including cancer.
So here we have, I mean, Dr. Linus Pauling, he got 2 Nobel Prize. So obviously he was somebody that is very well respected in the scientific community, and one of the things then that he really pushed was the vitamin C. How did that come about that he started looking at vitamin C as being such an important aspect in people's lives?
Well, he was a friend of Dr. Riordan's, Dr. Abram Hoffer, who is also known as the father of orthomolecular psychiatry. He and Dr. Riordan were great friends, and I think it was through Dr. Hoffer that Riordan was able to team up with Linus Pauling. And Hoffer, of course, was using orthomolecular. When we use the word orthomolecular, we mean using molecules that are natural in nature in the right dose. Ortho means correct or right. And so it turns out when you're in an emergency situation, you know, the old bucket brigade is not enough. You know, you really need the fire truck hooked onto the fire hydrant, pumping out thousands of gallons of water to put out the house fire. And so in a similar way, what Pauling recognized is that even though it was good to give high doses of oral vitamin C, it would be helpful like for a cold. But if you're dealing with a more serious health crisis such as cancer or a serious infectious disease like sepsis, you're going to need to hook up to the fire hydrant. And so that's what the IV vitamin C is able to achieve. We are able to take our blood level from 1 milligram per deciliter, which we typically run most of our lives, to easily 100. And if you keep escalating the dose, we have a target. Dr. Riordan established a target of 400 milligrams per deciliter in order to kill most cancer cells. At least that was the case that he published in terms of his research looking at cell culture. He could kill almost every cancer cell known with a dose of 400 milligrams per deciliter in the culture media.
So that's really fascinating. I mean, here you have all these chemotherapeutic agents that you're testing against these cancer cell lines, you know, the HeLa lines, you know, that they commonly use. And here you have something that is so harmless as vitamin C are able to pretty much kill every cancer. I mean, every cell line. Correct.
And now people will say, well, wait a minute, that's in vitro, that's in a culture dish. What does it do in the human body? Well, what Pauling showed by working with stage 4 cancer patients in Scotland, they were in a hospice hospital, and he could give them IV vitamin C 24 hours a day for 10 days, and then he switched it to oral vitamin C at least 2 to 3 grams 4 times a day, which would give them over 10,000 milligrams per day. He found that alone, and this was back when not much chemotherapy was being used, so these people had not been subjected to the ravages of high-dose chemotherapy. And so just this high-dose vitamin C improved their survival time by typically 4 times greater than the controls who did not receive vitamin C. And some people, about 10%, live 9 times as long. This is with stage 4 cancer, just by taking these large doses of both IV and oral vitamin C. So that was a huge breakthrough back in the mid-70s.
I mean, that's pretty incredible considering we know in regards to chemo, radiation, surgery, that statistically, I think it just improves the length of life by like 3%, I think, whether if you do those therapies versus not. Isn't that what the studies show?
That's correct. Over this long period, maybe 40, 50 years of using various chemo agents, even though there's been some breakthroughs in childhood leukemia, some of the male testicular cancers, and some of the lymphomas, there really has not been that great of a change. And the price that people pay, not only financially, but the amount of suffering that they go through in terms of receiving high-dose chemotherapeutics is really quite astounding. And if anyone has ever brought a loved one, like I brought my father to an oncologist, and just sitting in the waiting room, it's a pretty despondent situation. Now, having said that, the Riordan Clinic is not taking a stance against conventional oncology. There is a definite role for oncologists to play. The beauty of IV vitamin C, if more and more oncologists would use it, is that it does greatly reduce the side effects. There are probably more than 12, 15 studies now on using IV vitamin C in conjunction with various types of chemo. And there's a clear-cut improvement in quality of life and reduction in the side effects from conventional oncology. So I'm hoping there are people in your audience that realize that there are situations where conventional oncology definitely should be utilized. So we are trying to provide an integrative approach to the cancer care patient, but keep in mind also that we strongly help and recommend and help patients to pursue lifestyle change in a way that is congruent with a more stable immune system, with a better detoxification system, better pain control, reductions in their metabolic imbalances. There's a number of things that we can do to reduce the severity and the side effects of conventional chemotherapy, and at the same time improve its outcome.
Yeah, and I'd like to chat a little bit more about what vitamin C actually does, how it can work in conjunction with chemotherapy. We're going to take a quick break. You're listening to Health Made Radio. I'm here with Dr. Ron from the Riordan Clinic discussing vitamin C and the benefits of vitamin C, and both in cancer, viral infections, and many other diseases. We'll be right back. Welcome back to Health Made Radio. I'm here with Dr. Ron Hunninghake. He is the the chairman of the board over at the Riordan Clinic. So in regards to, you made a good point in regards to, just because chemo, radiation, and surgery just by itself does not really, it hasn't increased the length of life, that much, during the 50 plus years that we've been declaring war on cancer. But then in certain types of cancer, like, some of the bloodborne and that testicular, showing more promise there, but, still having a tough time in the other cancers. But then when you then combine it with other therapies, like you're talking about vitamin C, then the outcome, in addition to then working on some of the side effects of chemo, which can be quite devastating, what are some of the benefits that it can add to improve the effectiveness of chemo?
Yeah, this is research that's being done now at Cornell and University of Iowa. KU, Kansas University Medical Center, has published research, Jeannie Driscoll, on ovarian cancer using vitamin C in a conjunctive way. And what we find, and this is a very, very interesting point, Michael. A lot of the conventional chemotherapeutic agents are poisons, but let's call them oxidants because that's a better way to think of them. They're very powerful oxidants that are an attempt to target cancer cells, but there's unfortunately some of the healthy cells, the rapidly growing healthy cells like your hair follicles and your lining of your gut, they get pounded pretty hard by conventional chemotherapeutic agents. Now, keep in mind that there are so many new ones coming out. This does not mean all of them work this way. But looking at the classical oncology compounds, they are powerful oxidants. So a lot of people, including oncologists, mistakenly think that because vitamin C is an antioxidant, that it's going to have a negative effect, that it's going to somehow interfere with conventional therapy. What they don't realize is that, yes, at lower doses, vitamin C is an antioxidant, but the surprising thing is that you get above the 25-gram IVC infusion, that will give you blood levels of ascorbate where the ascorbate begins to interact with the high iron levels in cancer cells, and it creates hydrogen peroxide. And this hydrogen peroxide can then interact again with some of the enzymes within the cells and create the hydroxyl radical. The hydroxyl radical is the most powerful radical in the human body. So, and cancer cells predominantly take up the vitamin C because the molecule of vitamin C looks very much like sugar. And anyone who's gone through the whole cancer process, PET scans are where they give radioactive tagged sugar to advanced cancer patients to determine where it has metastasized in the body. And the reason this lights up on the scan is because cancer cells have shifted to a different type of metabolism that favors sugar. So IV vitamin C therapy takes advantage of this, and because the vitamin C looks like glucose, it is more readily taken up by the cancer cell. The hydrogen peroxide is formed, the hydroxyl radical is formed, and the cancer cell is killed from the inside out by high-dose vitamin C. So it's a little bit like a Trojan horse effect. The mimicry of vitamin C to glucose allows this phenomenon to occur. And at the same time, because regular cells do not contain high levels of iron except for red blood cells, and the vitamin C does not seem to affect those, the healthy cells do not have this phenomenon. It's kind of unique to cancer cells. So there is a selective effect of high-dose vitamin C in the care of cancer patients who are currently on chemotherapy. Did that make sense? That was kind of a long, roundabout explanation.
I think that was perfectly explained. So, like you're mentioning, the chemotherapeutic agents, they're pro-oxidants, and that's how they kill the cancer cells, by oxidizing the cancer cell. And then vitamin C in low dose, it's considered an antioxidant to then quench, this oxidative stress that exists throughout the body. Whether it's from pathogens or even cancer in itself, to quench the oxidative stress. But in high dose, it then becomes a pro-oxidant, so it works hand in hand then with the chemotherapeutic agent to enhance the killing effect of the cancer cell. Am I understanding that right?
That's exactly right. And just while we're on that subject, let me lateralize the comment, since you mentioned about IV vitamin C and infection. The same mechanism is at work. In this case, though, the reason it works is because your pathogenic bacteria, a lot of your pathogens that are infectious, they have also high levels of iron. And so it takes this interaction of vitamin C with iron. The vitamin C, what it does is it reduces the oxidized iron to the ferrous state, and this type of iron can then interact in the body and create hydrogen peroxide. And then hydrogen peroxide, by virtue of a reaction called the Fenton reaction, creates this hydroxyl radical, and that's what kills infection from the inside out. So it's really interesting that IV vitamin C is effective against cancer, and it's effective against chronic infections as well.
Yeah, one amazing book you mentioned, Dr. Thomas Levy, and I had the benefit of interviewing him earlier in the show as well. But his amazing book, Vitamin C, Infectious Disease and Toxins, Curing the Incurable, really going through all the different infectious diseases that we're dealing with and how beneficial vitamin C is in regards to all of them. And these are studies that he's pointing out and how it's functioning. So it seems to be a fear, for dealing with any kind of immune system challenges, it's a really strong universal tool.
Yes, and this is why nature, for millions and millions of years, this has been what, for example, the champion in nature is goats. They can take their normal production of vitamin C, 2,000 milligrams a day. If they get really sick, they can bump it up pretty quickly to 25,000 grams in a day. And so what we're really doing is giving back to the body an ability to deal with lethal threat in a way that is non-toxic to the body, but it's toxic to the infection and it's toxic to the cancer cells.
Great. Let's take a quick break. You're listening to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Ron Hunninghake. He is the chairman of the board at the Riordan Clinic. He's been there since 1989. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Ron Hunninghake. He is the chairman of the board at the Riordan Clinic, a clinic that has been a standard in regards to using vitamin C IV to address situations that are very difficult, such as people battling cancer, Lyme disease, and other infectious agents. So in regards to, we're looking at this pandemic, and people are scared in regards to, is my immune system going to be able to fight this? Do I need to take more drastic measures? What if I get it? There is research out there, and I know right at the beginning of the pandemic, in China, they published studies as to what they were doing and the success they were having in regards to COVID. Can you expand a little bit on that?
Sure. Let's start with the use of really high. We've been talking about high dose intravenous vitamin C. There's a lot of research, mostly coming out of Virginia. Dr. Fowler and Dr. Merrick are basically they are intensive care specialists patients who get into a septic state where their blood is loaded with pathogens. They were able to show that using intravenous vitamin C, along with a couple of other nutrients in Dr. Merrick's studies, namely thiamine, B1, and then he also put in just a small amount of cortisol, which helps the adrenals. Anyway, they were able to reverse sepsis, which is the end stage of chronic infection. This is why people die from infection. So that's using vitamin C in high levels. If you use, I would say 1 to 2 grams or 3 grams of vitamin C per day, you also do improve your white blood cell count. So people around the world who say, I want to know if vitamin C will help protect me. I think it's one very positive nutrient to be on because it does help your immune system. It does help you produce collagen and wall off infections. It does improve, your overall sense of well-being as well. There's a number of things that it can do to help you prevent an infection. Then if you get an infection, you can do high doses of oral vitamin C. There was a doctor in California who found he was working in a college, and when some of the students would come in with mono, they would be very, very sick. He found that their digestive system would open up and take a lot more vitamin C. And at those high doses, anywhere from 10 to as high as 100 grams of vitamin C given orally, that would reverse over time. It wasn't immediate, but it would take several days. It would reverse the mono. And so we have found that we can use high-dose oral vitamin C in people that are home and bedridden and can't get to intravenous vitamin C. They can still take high doses of vitamin C along with other key nutrients and have very good outcomes as well.
And that's an interesting point. People are so afraid. I mean, they may have had an experience with vitamin C orally in the past and had a upset digestive system from it at a certain dose. But like what you're saying is that when there's a need, like a viral infection, then the body is able to, it's requiring more, and then you will not have that digestive disturbance at the same level that you would if you were not infected, but you'll be able to handle quite a bit higher dose.
That's correct. And plus there are new forms of vitamin C called liposomal vitamin C that can be given every hour without even an average person can take 10 packets a day. That's 10,000 milligrams. And because it's liposomal, it absorbs anywhere from 2 to 4 times better. So using liposomal vitamin C, it can very quickly help mobilize your immune system to deal with the early stages of a viral infection. And so we encourage people to keep extra vitamin C on hand, especially with the pandemic still out there. It's really useful to have reserves of vitamin C on hand, even if you can't get to IV vitamin C.
And with the liposomal, like you mentioned, it's a better absorption, and that is because you have that kind of lipid package around it that's very similar to the membranes that we have, so it can easily pass through membrane and then through cell walls, etc. Correct?
Right, and it's also readily taken up into the lymphatic system. The lymphatic system is part of your immune system. And so the lymphatic system will take the vitamin C charged white blood cells quickly to areas of infection. The body has a signaling system which will cause the white blood cells to move more quickly to the area of acute infection. And much like we use the example of the fire truck, your white blood cells are the carriers of vitamin C. When there's an infection, they can increase their concentration of vitamin C by 20 to 30 fold, maybe even higher. And so they deliver vitamin C to the infected site. So Dr. Levy's book goes into this in a lot more detail.
And when it then approaches the infected site, we talked about then these infectious agents, having extra iron so what the vitamin C does with them is that it donates, you said, a couple of electrons to then pretty much kill off or trigger that oxidative stress to kill off the pathogen. So it's almost like the vitamin C is the bullet that the white blood cell is using to kill the pathogen.
That's exactly right. White blood cells, there are macrophages that can engulf infected cells, but if you're really wanting to to kill pathogens, it's the vitamin C that does most of the work in the white blood cells.
So when you're then dealing, obviously it's good to do as a maintenance, but when you're dealing with an infection and you are hit pretty hard or dealing with cancer, obviously at that point you would like to load up on a lot of bullets. So that's why it's good then to saturate it both intravenously and orally in every possible way that you can.
That's what we've always recommended in the Riordan protocol for cancer. We at the beginning of the pandemic, we encouraged our patients to keep extra vitamin C on hand, to possibly up their standard dosing of vitamin C a bit, and have some on hand ready to mega dose if they started to get early symptoms of infection.
Great. Let's take a quick break. You're listening to Health Made Radio. I'm here with Dr. Ron Hunninghake. He is the chairman of the board over at Riordan Clinic. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Ron Hunninghake, and we're discussing vitamin C and how powerful it is when you're dealing with extreme situations, such as we're faced with this pandemic that we've been dealing with, also with cancer and other life-threatening or chronic diseases. So when it comes then to dosing, I mean, you mentioned with vitamin C, I know in the book, Dr. Thomas Levy was saying if you're dealing with some viral infections, the body will then require almost like 200 grams in a day. So it's a tremendous amount that the body requires when it's under this kind of an assault. So what is with the Riordan the protocols that you use? Let's say if somebody is dealing with cancer, I mean, what does that look like practically?
Okay, so yes, Michael, coming back to cancer, when people live nearby, we basically start them out on 15,000, and on the first day we go up to 25,000 on the second day, and on that second day after the IV just finishes, we take blood out of the opposite arm to measure just how high have we gotten their blood level. If you remember back to early in the show, I was talking about Dr. Riordan's research, where he was able to show that once the level of vitamin C in the petri dishes reached about 350 to 400 milligrams per deciliter, all of the over 60 different types of cancer cells were killed at that point. So this appears to be the target dose, and so in the Riordan protocol, on the third day, if they've tolerated a 15 and 25, we'll take them to a 50-gram IV vitamin C, and after it's infused, we take blood from the other arm, and we want to see a level close to 350 or 400. Now, lately, it seems like it's harder to get that level, and I don't know if it's the fact that people are more stressed. There are more environmental toxins, whether we're talking about mold or Roundup, or other chemicals that people are dealing with. There are 78% of our population in the United States is suffering from metabolic syndrome, where their blood sugars are running high. They're either pre-diabetic or diabetic. This reduces their immune strength. So there's a number of reasons why people seem to be needing more vitamin C. So we have found that sometimes 50 grams is not enough. We've taken some of our patients up to 75, 100, and a few patients to 125 gram IVC infusions in order to help them catch up with the high level of oxidative stress that the cancer is causing in their body.
And so what kind of frequency, when you're dealing with something as severe as cancer, I mean, what kind of frequency are you seeing that they're needing the IVC? How long of a time period? Is it 2 months, 3 months? I mean, what is usually the pattern that you see so that people out there can know what to expect when they're stepping into that kind of a treatment?
Okay, so it's a very important question. It's going to vary a lot. I mean, Dr. Riordan, in an effort to create a standard protocol, recommended that we establish the treatment dose, whether it's 50 or 75, or maybe in some people, maybe 25 grams twice a week is enough if they have a low-grade early stage tumor. So there can be a lot of variation, but he standardized it at twice a week back in the 90s, and that particular protocol is now used all over the world. I've been to Japan 9 times, and there are over 1,000 Japanese doctors using the Riordan protocol, and this is not unusual around the world. What we're finding, though, is a lot of people are having to individualize the dose according to the severity of the cancer. And so one of the trends that we are hoping to get financing on so we can publish, but we are using for people that want to really put out the fire of the cancer that they're dealing with. In addition to the 3 days of vitamin C each day, we are offering extended care at the Riordan Clinic Integrative Oncology Center in Overland Park, Kansas, which is in Kansas City. And that's where they get an IV vitamin C infusion every day for at least 1 week, sometimes 2 or 3 weeks, depending upon the extent and staging of their cancer. So we are looking into a more aggressive form of intravenous vitamin C for people who have more aggressive tumors.
So, and like you're saying, I mean, when you're dealing with that that level of fire, when you have cancer all over the place, stage 4, and it's located in many different areas, you just need at that time, turn up the fire hose to really address that with enough water to be able to quench that fire. So that's important then for the individual practitioner to be able to monitor that.
Correct, and also keep in mind that as the evolution of integrative cancer care has evolved, we now know that the principle of synergism is quite important. So we're not depending upon IV vitamin C alone. We do over 100 different blood tests to assess the nutritional terrain of the patients that we are seeing with cancer or other chronic illnesses. And we address those deficiencies with either oral supplementation, well, not or, it's oral supplementation and diet and other modalities such as fasting, ketosis. There's a number of things that we can do, detoxification, the importance of exercise. There's getting to be a fairly significant repertoire of lifestyle changes that have been shown epigenetically to improve outcomes in advanced cancer patients that they work very well with IV vitamin C. So IV vitamin C is one of the top or aggressive therapies, but nowadays we don't rely upon vitamin C alone. We like to have our patients address all of the important lifestyle issues that could be perpetuating the growth of their tumors.
Yeah, and I know Dr. Nasha Winters had the benefit of opportunity to interview another show. She's a kind of big leader or driving this where you kind of test and assess, and you test and then you assess and see what's going on and then treat. So that's why, all these different tests are so important to really know what it is that you're dealing with and have a clear picture. And then by addressing these underlying factors, then, these powerful tools like vitamin C becomes even more powerful because it has less resistance to fight through. Yeah,
I and my practitioners at Riordan Clinic are now studying under Dr. Nasha Winter's Metabolic Approach to Cancer program, which ironically kind of comes full circle because most people don't know that Dr. Winters is a native of Kansas, and in her high school years, she came to the Riordan Clinic and had lunch with Dr. Riordan when she was a teenager before she developed cancer early on in her life. And so Dr. Riordan probably told her, test, test, test. He basically said that's the most important thing because otherwise you're flying blind. And so Dr. Winters definitely learned her lesson, and she's a living example, having had ovarian cancer for 30 years and successfully held it under control. She's a good illustration of how this combination approach of synergistic therapies and metabolic therapies can help people who have even the worst prognosis. We find that we can help people turn things around if they are able to put enough of these practices together in their own program.
That is pretty fascinating. That her early experience with Dr. Riordan that is kind of made her such a champion into what she's doing now and contributing so much into this arena while battling cancer with appropriate nutrition and lifestyle changes and epigenetic changes that she does. So that is pretty fascinating,
isn't it?
So you mentioned also while we're talking about the vitamin C, you're mentioning that you're seeing that people are needing more and more lately, and you're trying to figure out what that was. But in that comment, you said that it seemed like vitamin C then has an impact in clearing. You're talking about mold to help to clear toxins from mold and clear heavy metals and chemicals that we are exposed to. So not only then oxidizing then the cancer cells and infectious agents, it's also a strong detoxifying agent as well.
Oh, absolutely. It's, just a quick comment on Dr. Nasha's program, there are 10 terrain elements that sustain chronic illness, especially cancer. And then you've mentioned several of them: toxicity, abnormal blood sugar, inflammation, stress, poor sleep habits, insomnia things. Anyway, vitamin C directly or indirectly helps mitigate against all 10 of those issues, one way or another. So it's to me, it's a we have a saying at the Riordan Clinic: IVC first. There are a number of people who are familiar with vitamin C who will tell you that if you're dealing with a patient and they're not well, the first thing you want to do is get the vitamin C started and then do all the rest of this work, but don't wait to start the vitamin C because it can begin the healing process right off the bat.
And that is no matter what is going on, the vitamin C will be beneficial, because of its kind of broad action, but at the same time very targeted where it's needed.
Yeah, it takes us full circle in our discussion today that every creature, when they're sick, they start making lots more vitamin C. And so all we're doing is mimicking the nature that we lost somewhere in time, and we hope in the future through new research to maybe restore that, because the gene is still there. We still have the gene to make vitamin C, and there are some products now on the market which some early research has shown that they can reactivate the gene, so people are making at least small amounts of vitamin C 24 hours a day. And we hope that, plus the large orthomolecular doses of vitamin C periodically throughout the day, will help people deal with the many factors that go into chronic sustained illness.
Right. Well, Dr. Ron, it's such a pleasure to have you on the show. And I'm so grateful for the amount of knowledge and information that you share throughout the world and guiding people in the area of battling chronic illness, which is we need more information, more tools, and people having access to these kind of tools that the Riordan Clinic offers becomes more and more crucial as we're dealing with more and more stressors, more toxins, more heavy metals, more infectious agents. More and more people are dealing with cancer. So these type of tools become even more important. So thank you so much for being such a champion for that.
Well, Michael, and thank you for what you're doing to get the word out, because people are desperately looking for safe ways to improve their health. And I think you're making a huge contribution by using the airways to help people discover these methods. So thank you for your contribution as well.
Well, thank you. That is it for today. You're listening to HealthMade Radio. And remember, check us out at healthmade.co. Health is what you make it. 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 Health